When I talk about herbs, I want to make it clear. I am talking about plants that are natural. I'm not talking about aloe vera. I'm not talking about noni. I'm not talking about ginseng. I am talking about natural plants that are electrical. And they sound like this. Kokulmeka. In Jamaica they call it the iron root. I'm talking about burdock, shepherd purse, yellow dock, prodigiosa. There's a difference. Meaning that the natural plant came with nature from God. The other plant was made in a laboratory through the process of hybridization. The plant that came with nature has a carbon-based structure. The plant that came from the laboratory, not so.
Hey y'all, so it's Naya Tashe and I'm back with another YouTube video. So today y'all, I have on green, I have on my green skirt and my green shirt, and I'm repping the plant tribe today. Why am I repping the plant tribe, you may be asking? Well, because
I will never talk to a doctor about my general health ever again. If I break my arm, I'm gonna go see a doctor. If I need surgery, I'm gonna go see a doctor. My general health, never again. None of them know what they're talking about. They're all full of shit. All they know is to put you on pills and put you on medicine. That's all they know.
We're gonna be talking about how the medical industry is designed to keep you fat and addicted. Now, we know how annoying colds are. We know how annoying being sick is. This leads us to have stuffy noses, watering eyes, constant coughing, and literally always sneezing. Especially in this economy, taking off of work and just healing our bodies on our own, it's costly to do so. So that leads us into the doctor's offices to get prescribed medication. Sometimes access to medicine can seem more convenient than actual access to proper care by medical professionals. This makes me wonder, when did medicine become a commodity? I found that rapid use of pharmaceuticals only has recently taken off in the last 80 years. Before this, holistic healing was very popular and far more common. When you garden and plant, you notice two things. You notice the extent of human control over certain crops and how humans frequently create variations of certain plants. This can be used for good and this could be innocent, because you may have like a tomato plant, for example, and instead of wanting it to vine, you may want it to bush. So that's why you have different variations of tomatoes, like a bush tomato or a vine tomato. That's one way it can be used, but it can also be used for bad. So people can extract the properties out of plants to make certain pills. Doctors and scientists realized that by isolating addictive properties from plants and putting them into a capsule or a pill to sell to the masses was much more easier and better for never-ending wealth for these people. Chemists also began creating their own versions of plant compounds. The development and mass production of chemically synthesized drugs revolutionized healthcare. However, before this shift in the early 1900s, using herbs and plant science was the absolute norm. So let's talk about the history of herbs really quickly. While the use of healing herbs has a reputation for being new age and new spirituality, this has been going on for thousands and thousands of years. And if you're a Bible believer, they talk about certain herbs in the Bible as well. Researchers have found evidence of yarrow chamomile being in the mouths of Neanderthals. That's 60,000 years BCE, before the Common Era. Do you guys know how long ago that was that they were using herbs? But of course they were using herbs, because that was what was at their disposal. Hippocrates, a famous philosopher, also used many herbal remedies in his practice and famously wrote, "Let food be thy medicine and let medicine be thy food." So what has changed? Herbalism into the 18th century. The great age of herbalism is said to have occurred from the 15th to the 17th century. Herbal books were becoming available in English, having been translated from Latin and Greek. One of the first herbal books to be published in Greek was Gret Herbal in 1526. It mentions rosemary, lavender, mint, and chamomile. Women also played a key role in herbalism, gaining popularity in the American colonies. Because women were often called on to collect roots and to care for their families, the plant-based medicine of the Native Americans was key in helping the Europeans adapt to American terrain.
This is exactly why they're trying to ban this book. over 300 pages of herbs and remedies on how you can treat all kinds of various illnesses, usually in all kinds of natural, holistic ways. And this book.
The role of Black, Indigenous people and people of color in America must be mentioned when speaking about the continuation of herbalism in the United States. Some famous herbalists were George Washington Carver. Absolutely, George Washington Carver was the most famous Black herbalist, and he helped white farmers learn about their farms as well as helping Black enslaved people learn about plants. He was also illiterate. In the mid-18th century, some states made it illegal for enslaved people to teach or learn about herbal medicine. So this is where the controlling tactics started to be implemented. And in 1904, the formation of the Council on Medical Education by the American Medical Association changed the course of herbalism in America and Canada. The AMA wanted to set specific standards for medical education that had to be met by medical schools. Schools that couldn't meet these standards were shut down. Let's talk about who benefits from not using plant medicine.
People just run to their medical doctor. The first thing that they do is get the antidepressant, the anti-anxiety drug, which are incredibly dangerous both short-term and long-term, especially for children. Rather than go that route right away, the easiest thing to do is to start using essential oils.
Hospitals, doctors, they all work alongside big pharma companies to keep you addicted and to keep themselves paid. Truthfully, if they allowed their patients to use lavender instead of Xanax, for example, or mugwort instead of abortions or contraceptives, then they wouldn't need us coming back on top of other things and other problems that they give us.
Goes against this healthcare, or should I say sick care, way of thinking that helps you avoid accountability for anything and that keeps you alive and surviving instead of actually thriving. All of our ancestors knew this, and that is why there are ceremonies all around the world that include plant medicine.
We would be fine using a plant and using the benefits in the way that it was supposed to be used and getting charged less, because you can grow these things in your own garden. The doctors have a bad habit of trying to fix things that aren't broken. Why are you offering alternatives for perfectly safe herbal medicine? That doesn't make sense to me.
Okay, this needs to be talked about. I feel like there are two different trains of thought when it comes to health and wellness. And I think this is why there is so much disagreement upon people on what you should do for your health, Western medicine versus natural remedies, because there's totally two different paradigms people are coming from. The first paradigm is your body is something that can be broken and you need something to fix it. So this falls into more of the Western medicine paradigm. The second paradigm is this: the body can become imbalanced, but if you do the things necessary to help rebalance the body will heal itself. Do you see that difference? The Western medical approach says your body can be broken. You get an illness, you get an infection, you get a disease, you need a medicine or a treatment to fix it. Versus the natural remedies holistic health approach is your body becomes imbalanced. So you do the things necessary to get your body back into alignment and the body will heal itself.
And big pharma are known as the biggest drug dealer, with the doctors giving out more of their drugs than they do of any other kind. It is proven by a new ProPublica analysis, which finds doctors who receive payments linked to specific drugs prescribe more of those drugs. And doctors who receive money from drug makers related to a specific drug prescribe that drug more heavily than doctors without such financial ties. So this obviously shows us the connection and the link with doctors and certain big pharma companies and how they're being paid off to prescribe more drugs or prescribe less drugs. Pharmaceutical companies happily reap the benefits of laws that allow them to increase their prices at their own discretion. 11 of 13 pharmaceutical companies selling these top drugs made more money in the US from those drug sales than they did from the rest of the world combined. These enormous disparities hurt American citizens and American consumers, and a new study done by Commonwealth Fund found that the US healthcare system is ranked last among 11 wealthy countries, despite spending the highest percentage of its gross domestic product on healthcare. So let's talk about the history of medicine a little bit. We've talked about the funding, where are they getting the money, what are they using the money for. So let's talk about the history of medicine. So remember we talked about how the AMA banned herbal medicines from being taught in medical schools. Then we went into the funding and how much they make a year, which totals around $101 billion. So they're making that much money. What do you think is the history behind this big monopoly that is the healthcare system? The truth of the matter is, this part of history is often overlooked, and it's something that I came across and I was very interested in. Did you know that the history of Western medicine starts with John D. Rockefeller? John D. Rockefeller is widely considered the wealthiest American of all time. Get that into your head. Of all time. Do you know how wealthy you have to be the wealthiest American in all time? And he's probably the most famous for securing a monopoly in America's oil market, but many haven't heard the rest of the story. By the turn of the 20th century, Rockefeller controlled 90% of the petroleum refineries in America through ownership of the Standard Oil Corporation. This later turned into gas stations, Mobil, Chevron, Exxon, etc. Concurrently, around 1900, the science world was getting excited by the new petrochemicals and the ability to create a variety of compounds from oil. During the same era, in the early 1900s, scientists were doing groundbreaking work trying to understand the basic mechanics of life and human health. It was during this time that most of the essential vitamins were discovered. Vitamin A, vitamin C, vitamin D, B1, B2, and biotin. Identifying these vitamins, science took a huge step forward and enabled simple vitamin remedies to cure conditions that were caused by vitamin deficiencies, such as scurvy and rickets. Scientists were also involved in research to recreate synthetic versions of these vitamins in a laboratory. In 1935, vitamin C became the first vitamin to be artificially synthesized in Switzerland. Rockefeller was smart enough to see this as a big opportunity with the possibilities that vitamins and medication could be developed from petroleum. He saw the chance to control and monopolize multiple industries at once: petroleum, chemical, and medical. Petrochemicals were ideal from a business perspective because they could be patented, owned, and sold for high profits. But there was a big problem with Rockefeller's plan. Natural and herbal medicines were very popular at this time. Almost one half of the medical colleges and doctors in America were practicing holistic medicine, using extensive knowledge from Europe and Native American traditions. Rockefeller knew that in order to get control of the medical industry, he had to expunge the competition. Rockefeller's first move was to use his vast wealth from oil to purchase part of the German pharmaceutical company, IG Farben. IG Farben was later involved in World War II as well. You gotta think about that. Now that he controlled a drug manufacturing company, he could move forward with his plan to eliminate the competition. In the early 1900s, there were a variety of doctors healing modalities in America. To eliminate the competition, Rockefeller hired a contractor named Abraham Flexner to submit a report to Congress in 1910. This report concluded that there were too many doctors and medical schools in America and that all the natural healing modalities which had existed for hundreds of years were unscientific quackery. The report called for standardization of medical education, whereby only the AMA would be allowed to grant medical school licensure in the US. So, Flexner's report certainly did have some points, but unfortunately the motives of the report were entirely driven by Rockefeller's desire for complete control over the medical system. Based on the report, Congress acted upon Flexner's recommendations and changed laws related to the medical practice. Incredibly, allopathic medicine became the standard modality, even though at the time its main treatment methods were bloodletting, surgery, which was quite barbaric at the time, and the injection of heavy toxic metals like lead and mercury to supposedly displace disease. With new laws in place, Rockefeller teamed up with Andrew Carnegie and started funding medical schools all over America on the strict condition that they only taught allopathic medicine. Through the power of their huge grants, this powerful team systematically dismantled the previous curriculum of these medical schools, removing any mention of the healing or powerful herbs or natural treatments. Teachings on diet and other non-drug treatments were also completely removed from the medical schools. And after removing traditional medicine from medical schools, Rockefeller made sure to secure his monopoly by launching a targeted smear campaign. One shocking fact I found was that Rockefeller went into China to try to change the traditional Chinese medicine system. And he was not able to do that, but this just shows the absolute greed and tirade that he was on, going through different areas and taking the cultural practices and trying to change them. So unlike other industrialized industries, our laws and regulations allow pharmaceutical manufacturers to set their own prices, basically, and they price gouge. And if you're wondering, okay, so we're paying higher prices than many other countries for medicine that we need or medication that we need. Where's this money going? Well, I have the answer for that too. Follow the money. Money can always be tracked, and it's going right to the FDA. Who's the FDA? The Food and Drug Administration. And these people are the people that's letting these harsh drugs just come through. They approve and they disapprove drugs. They say this is safe and this is not safe. They made it so children can get things like morphine and get prescribed oxycodone for pain. Weird, but you know, they need their pain medication, I guess. So go ahead and get your child addicted. Don't come and argue with me in my comments about that. I personally feel like there's been many instances of the FDA taking away drugs that are needed or approving drugs that are dangerous, approving drugs that have terrible side effects. And before you say, well, plants have side effects too. You know, haven't you heard of poison ivy? Or haven't you heard of the mother-in-law's tongue? And you're right, I have heard of the mother-in-law's tongue, or the snake plant, which was used to harm enslaved people and hurt their vocal cords. And I have heard of poison ivy, which was used in war. They would burn it, they would set off the fumes and set off their enemies. And people use these plants that have these negative effects for negative reasons. It's in the name, poison ivy. I'd stay away from that. Mother-in-law's tongue, I would stay away from that. Just based off the name, it sounds menacing, okay? So these plants have it in the name. Morphine, oxycodone, oxycontin, these things don't have it in the name. The big warning, the big, hey, don't eat me, hey, it's honestly seen as good, you know. And opioids, they act as like endorphin, they mimic our endorphins and things like that. And not only that, they are pain killers. They kill the pain receptors, so they really are effective in helping with pain. But if we know the effects on drugs for adults, why would you give it to your kid? And I just want to touch on how schools are being brought into this big medical system monopoly as well, because now children as young as 9 and 10 are getting diagnosed with ADHD and getting prescribed Xanax or Adderall at the young ages of 9 and 10. More concerningly, the US FDA approved the opioid painkiller OxyContin to be used for children as young as 11 in hospitals, sparking a national outcry, as it should. Experts trace today's heroin epidemic to overprescription opioid painkillers. As an educator, I think that it wouldn't be smart for me to promote giving children Xanax or Adderall before we try to come up with more better ways to deal with their behavior or deal with whatever problems they may be having. People are too comfortable bringing hard drugs into their kids' lives, drugs that they wouldn't even bring into their own life, just because a teacher said so or just because a doctor said so. The most commonly prescribed parental opioid is fentanyl, and another one is morphine. We know the dangers of that. We know that children can become dependent on these things, and we also know that the body can become dependent on these things. And children can lose their lives from withdrawal even if they aren't addicted, just because their body becomes used to this opioid painkiller. It isn't inherently bad that opioids are a class of drugs that are naturally found in the opioid poppy plant. It's a plant and it it was used, it was taken, the most addictive parts, and it was extracted to serve a purpose, which is to kill pain. The use of opioids have been prevalent among many civilizations as well. The ancient Sumerians, the ancient Egyptians, even ancient Great Britain. And there were also places that weren't okay with opioid use, like China. This led to a big war called the Opium Wars between China and Great Britain. Great Britain had the great idea to fund their ever-increasing desire for Chinese-produced tea and trade by smuggling opioids into China. This caused a huge war, and this also caused China to have a war on their own people, jailing and capturing addicts that were addicted to opioids to try to balance out the opioid crisis that was going on during this time. This led to 2 major opium wars, which Great Britain won the first one. To this day, it's still one of the most talked about wars in history, all because Great Britain said, hey, we want some Chinese money. We want some Chinese taxes. So we're gonna put a drug from India into your economy. Which is why we now have China reverse. We have China reverse doing that, and now fentanyl is coming into the American borders from China and India. This, in my opinion though, only leads back to one thing. Big Pharma making their own pockets bigger, while Americans suffer at the hands of these people. People talk about our privilege with our doctors. Don't get me wrong, I appreciate everything we have here. The Medicare, but Medicare and healthcare hasn't been the same for a long time. We will always need medicine and doctors for certain things, but as much as I can, I just want to let people know, safer alternatives to pills, to medications, to being injected with something. There are safer alternatives that have been used for over thousands of years.
Did y'all notice, though it does not affect the production of sperm, neem kills sperm instead? Both males and females can take neem extract or neem oils as a contraceptive to prevent pregnancy in a most effective way. Injecting neem oil through the vagina can cause reversible infertility in female for about 1 year. So who else is going to be sticking neem oil in their vagina? I mean, we got to do what we got to do. And people have been having natural remedies for abortions for centuries and centuries, since women could get pregnant, you know. So I'm just going to be sharing different things, and everybody's body is different, as you know. So do your research, but listen, a little knowledge don't hurt nobody. Neem oil sales are definitely going up.
They use what comes from earth and they use it at their disposal. There's a reason that Rockefeller is one of the most powerful American families. They chose war on their citizens to intentionally break down the connection that we had to the land. And I don't mean just black people. I mean white, black. Through slavery, Americans in general had a strong connection to the land and cultivating and gardening in the land. And we knew so much about that. Now these people have made it so we rely on them. We rely on them for medicine, for planting, for food, for gardening, for school, for whatever. This has affected all of us, no matter the race, no matter the age, no matter anything. And it's sad that we have reached a time where we don't even know the smell of flowers anymore. We don't even know the smell of roses. We can't even smell the smell of poison because we are just so out of touch with the connection of the land and nature. We have to go back to that. I'm sorry, we have to go back to that.
Drink sea moss.
Sea moss?
Sea moss.
And what does that do for you?
Sea moss, well, see, the body is comprised of 102 minerals, and sea moss has 99 of them.
No kidding.
So, thank you all for listening to my rant. This has been a long and drawn out video. But if you enjoyed this video, I think that you're really going to enjoy an older video I have called The Medical Industry is Based on Racism. That video I put so much time and research into, and I really hope that you guys go ahead and you watch that and you learn even more about the medical industry, because this is like a part 2 to that. We talked about the medical industry in terms of schooling and doctors, but in that we talked about how the medical industry used black slaves for experimentation. So just the medical industry in whole, I don't trust. I'm going to be very honest with you. And I'll appreciate it if you guys watch that video, you give this video a big thumbs up and like, and you guys let me know what's your thoughts on this whole ideal. Will you continue going to doctors? Will you continue getting prescriptions for medicine? And if you absolutely need it for chronic pain, I'm not talking about you. For the love of God, I'm not talking about you. I pray that you get healing. I pray that you get everything that you need. And I wish that there was a better way. If you have AIDS, HIV, I'm sorry, I have to put this warning at the end. Go to the doctor. Go get your medication. Like, I'm not Dr. Sebi, and I wouldn't recommend y'all listen to these Dr. Sebi wannabes and y'all stop taking y'all medication because y'all want to heal your HIV with a plant, or you want to heal your AIDS with a plant. And I have seen, when I was looking for research in TikTok videos, people in the comments, does this heal HIV? Does this? And there's people that are actually selling people cures to HIV and AIDS. Go to a doctor. I just want to let you guys know, like, you know, I pray for your healing, and I pray you're trying to find whatever you can. You're trying to do whatever you can in your will to just make sure you're safe. But out of, like, I don't know, out of like common sense, just please make sure you go to a doctor before you're trying to use any herbs as an alternative for your medication. Make sure that you're at least running this over with some holistic, like real holistic doctor, and not a TikTok holistic doctor, not no NLE Choppa holistic doctor, a real holistic doctor. Thank you guys, and I'll see you in the next one.